going to get to our speakers or presenters, and the first we have from WHO, the World Health Organization, Europe Mental Health Coalition, and the European Framework for Mental Health, Ledia Lazeri, I hope I'm correct there, and has been Regional Advisor for Mental Health at the WHO Regional Office for Europe since May 2021, having served as the WHO representative to various European countries, where she led WHO technical cooperation. So in her function as Regional Advisor, Dr. Lazeri leads a team that brings together expertise in various areas such as policy and services, rights and advocacy, communication and promotion in mental health, and tasks among others with implementing the WHO European Framework for Action in Mental Health and with supporting the PanEuropean Mental Health Coalition. So I'm sure we'll have plenty to hear and to hear from Ledia, so we look forward to her presentation. So thank you, and it's remote, I believe. Yeah.
Yes.
Great.
Good afternoon. Thank you very much, Madam Chair, for the kind introduction, and thank you very much to the European Parliament for maintaining an interest in mental health and for being the biggest advocate in the region to advance mental health agenda overall. Thank you also to the Alzheimer Europe, who is a precious partner of WHO in the area of mental health of older adults. And while we are working together to advance the dementia agenda in the region, we indirectly contribute together to the wider mental health agenda. So, as I was introduced, I'm leading this team in the WHO Europe that is implementing a flagship program. It is a flagship program it was envisaged as a flagship program far before COVID hit. And now with the war in Ukraine and all the ramifications in the mental health of the directly affected population, but also larger, it is clear that having identified mental health as a flagship program was the right decision. So I'm here to say a few words about the basis of our work in the WHO region, that is the European Framework for Action on Mental Health, which lasts until 2025, and the WHO Pan-European Mental Health Coalition, that is its operational vehicle. If I can have the next slide, please. Yes. So what is the background? Where do we start in working on mental health in the region? What is our starting point? And the starting point is a tremendous burden of mental ill health for European citizens. And we knew that before COVID, we had nearly 120,000 European lives lost yearly to suicide. And as evidence shows, suicide is a preventable mental health condition. So we have 120,000 European lives that if had they received more support, that loss could have been avoided. We had 1 out of 5 years lived with disease were due to mental health conditions. We had only 1 in 2 people with mental health conditions that received any kind of treatment and support. And for us in WHO Europe, for us the European region goes beyond European Union, and what we know is that the treatment gap, because what I just said reflects the treatment gap in Europe, the treatment gap though is higher, more eastward we go in our region, but remains to say that even within the European Union, the treatment gap is pretty high. The economic costs prior to COVID, as you might have met this figure before, were up to 4.1% of the GDP in the EU alone. And the mental health nursing workforce alarmingly decreased by 13% during 2014 to 2017. We now have the new mental health atlas that was published at the end of last year. And what we have seen is that there is very slight improvement in the mental health workforce between 2017 and 2021. And this is very likely related to COVID impact. So that made many services to mobilize more mental health resources. But still, even this increase, it's nowhere nearby the figure that was before 2014. What happened post-COVID? We saw an estimated 25% increase of major depressive disorders and anxiety disorders in the first year of the pandemic alone. We are now bringing the estimations for the second year of the pandemic, but we already have seen a very significant increase. We have pooled estimates that indicate a doubled incidence of elevated depression and anxiety symptoms among youth. So youth are among the most affected parts of our societies. We have seen a disproportionate impacts of vulnerable groups, such as on women and older adults. And especially people with a history of mental ill health had experienced highest level of loneliness during COVID. If I can have the next slide, please. So all these figures and were aligned to constitute what we now call the European Framework for Action on Mental Health 2021-2025, which received an overwhelming support by all the 53 member states of our WHO European region, which means that all the member states that you, all the countries you represent here in this room really, truly trusted WHO to move ahead the mental health agenda in the region. Of course, our framework for action in Europe is very much aligned with the comprehensive mental health action plan that goes up to 2013, but it is of course adapted for our region. Next, please. Thank you. So what are the priority areas of the framework for action? Those three boxes here represent the three pillars of the global program of work in WHO globally, but also the European program of work. And if I can list those here, the first pillar is moving towards universal health coverage. And in mental health, this translates into achieving mental health service transformation. We have all over the region remnants. In some countries of our WHO region, we have still mental institutions that prevail in the constellation of mental health services, but even in many countries of the European Union, we see that remnants of mental asylums prevail, and they still need. So there is still a lot of work to be done to totally replace them with community-based, person-centered mental health services. The second pillar in the framework for action is protecting people better against health emergencies. And what we talk about here is to integrate mental health into the overall plans for preparedness, response, and recovery from crises and emergencies. If we hadn't learned enough from COVID, now the war in Ukraine makes it very, very clear that with resilient health systems, with very strong mental health components, the systems will be able to affront the implications and the complications into the mental health of the public. And if I can make a paragraph, if I can put a paragraph here, this is what we saw in Ukraine. During the conflict in Crimea, WHO, after that, immediately in the aftermath of that, WHO worked with Ukraine to support a very large restructuring of its mental health systems. And since 2014, WHO and the government of Ukraine have worked together to multiply the networks of community-based mental health services, to strengthen the capacities of mental health workforce, but also to expand mental health to primary health care. And this is why now, with the war in Ukraine, we see a mental health system that is still it's still standing. It's not only standing, it's performing. It's able to trace every single person with known mental health conditions, and able to identify how to relocate people, where to relocate people with severe and enduring mental health conditions. So I made this a case to illustrate how important is that part of protecting better people better against health emergencies is to include mental health into the emergency plans. The third pillar in our framework for action is ensuring healthy lives and well-being for all at all ages. And here in mental health will translate into promotion and protection of mental health over the life course. So it is within this box that that I suppose I am invited to join you in this meeting today, because mental health and well-being of older adults would fall for us under this pillar. If I can have the next, please. Yes, thank you. So then what you saw before, the boxes that describe the pillars of the framework for action, are now deconstructed into actions. And for the sake of time, I'm only highlighting how in the third pillar, that is ensuring healthy lives and well-being for all at all ages, you'll see the red box here that it refers to mental health and well-being of older adults. I'm keen to mention the well-being because this is a paradigm shift that we want to bring in the WHO European region when we talk about mental health. Our citizens feel entitled not only to have the absence of mental health conditions, they are entitled to well-being. And therefore, now you will hear more and more WHO talking about mental health and well-being as an inseparable binom due to the expectations of our citizens for prosperity in their and well-being in their lives. Next, please. So how shall we then operationalize? Because some of you probably in the room will be wondering, how can this be done? We have seen in the last few decades that both WHO, member states, European Union have talked over and over again about the need to reform mental health services, to expand access to mental health care, to make mental health services affordable, accessible, appropriate, adequate. And this has not happened to the extent that all of us wanted. Why is that? There are a number of bottlenecks when we talk about mental health implementation of policies and services. But one major bottleneck is that mental health has been far too long in its narrow niche. It has been for far too long considered as one small silo in the big ocean of silos that usually our healthcare leaders operate with. And if we have learned something during the last few decades, is that we cannot expect to achieve mental health objectives without having mental health being made a business for the whole of government and the whole of society. And the PanEuropean Mental Health Coalition is indeed the example of how we are aiming at making mental health a business for all. Because the coalition includes not only representatives from all our 53 member states, but also, and not only the big international NGOs that operate in the area. Alzheimer Europe is, for instance, one of those. All professional associations, such as the European Psychiatric Association, such as European Psychological Association or European Nursing Association, or other big NGOs, such as, for instance, Mental Health Europe, that enjoys great support and is an umbrella association for other European civil society organizations. But we want to expand these to also sectors that were not before around the table, such as, for instance, labor and employment sectors. And why is that? For two reasons. First of all, we have seen that there cannot be integration into the society of people with severe mental health conditions unless they are empowered to have gainful employment. And mind you, I put the emphasis on gainful because it's not enough to have people with severe mental health conditions be put into some sort of activity, but they need to, like other members of the society, be gainfully employed. And the second reason why we are partnering with labor and employment organizations is that most of us do live our lives, a great portion of our lives, at the workplace. So unless we have an enabling, empowering, and mentally healthy workplace, then we will not be as, our well-being will not have reached the extent we all aim at. So for those two reasons, we are now partnering with labor and employment organizations, both at the European level, but also at the national and subnational levels. So We have identified 6 working packages within that would be supporting the achievement of the objectives of our framework for action, and those will be delivered in collaboration with those entities that you see on the left side of the slide. But the working packages, as you can see under the little graph there, that represents the coalition and its working packages. And again, in red, you'll see the working package on mental health and well-being of older adults. Now, for those of you who have an interest and experience and probably expertise with mental health, you may argue with me, and you'll be right to say, hold on a second. This is a very fragmented scheme, because mental health is a continuum. We cannot pick and choose aspects of mental health to put in that graph there. For instance, take the life course approach. If we are a family or 2 generations, and we have also older people in our large family, etc., we cannot fragment mental health of the various members of our family because of their age group, because as you very well know, there is a continuum there. Mental health and well-being start from the very young ages, and then to be a mentally healthy older adult, there are some things that need to be taken place beforehand. And that's why we are aware of this fragmentation, but we also know that for the purpose of moving ahead the agendas that are represented by each of those packages, we need to focus on them temporarily separately, so that when we will have worked and developed the deliverables, so the strategic documents for each working package, we can come back and put them as the pieces of a puzzle in one frame to ensure the continuity of mental health. Please also be mindful of the foundation of our coalition, that is mental health data. And I want to draw your attention on that, because we in WHO are as good with data as our member states are. But as many of you may be aware, countries have different ways of collecting data, of analyzing data, and of utilizing data. Not all countries utilize data to the same extent and with the same quality for purposes of evidence-based policy making, for instance. And that's why it is somehow difficult for us to compare data from one context to another, but also longitudinally from one year to another. So it is somehow difficult to measure progress, to measure a systematic progress on mental health in our region, which is why we acknowledge that mental health data is the foundation of our coalition work and will be the sine qua non precondition for achieving the objectives of our framework for action. Next, please. Now, within the coalition, the working package number 3, you may remember from the previous slide, the working package number 3 is dedicated to the mental health and well-being of older adults. And the areas of focus here for us are to support the implementation of the WHO action plan on dementia, and it was mentioned by Madam Chair before, through the development of national dementia policies and action plans. And here, for instance, we consider Alzheimer Europe as a preferred partner when now that we are approaching our member states to enhance the development of national dementia plans. And the second area of focus is to strengthen healthy aging initiatives and dementia prevention and care through engagement of community resources. And this is done from what we call the risk reduction strategy. We want to align with the goals of the UN Decade on Healthy Aging, and we want to partner with existing networks, WHO existing networks such as Healthy Cities and Regions for Health Network. If I can have the next, please. And very briefly, I'm sure that many of you will have seen this graph that represents the 7 action areas and targets of the Global Action Plan on the Public Health Response to Dementia. And as you see, it calls the Global Action Plan calls to consider dementia a public health priority, calls for dementia awareness and friendliness, calls for dementia risk reduction, calls for better capacity for dementia diagnosis, treatment and care, calls for supporting dementia carers, because the overwhelming support for people with dementia comes not from the healthcare facilities, but from informal carers such as family members or friends. The next action area is improve information systems for dementia. And the last but not least is dementia research and innovation, so that we can know more, so that we can offer more evidence to our policymakers, such as yourselves sitting in the room. If I can have the next, please. Now, we had a month ago, more than a month ago, we had the first meeting of the PanEuropean Mental Health Coalition. And we focused on the 6 working packages that I mentioned briefly. And what you see here in this slide is the areas that came out of a 2 days discussion of a working group of about 30 participants coming from all walks of life on priorities and actions from the discussions on mental health of older adults. And you'll see what came out of that discussion that we will, of course, action through further collaboration, is to increase participation of older adults in policy and service development, as well as in advocacy activities, is to address ageism and stigma and avoid associations between aging and frailty and vulnerability, which is very often the norm of the public discourse about aging and older people. It's the third action is to conceptualize dementia as everyone's business, and it needs to emphasize the role of communities in supporting and promoting healthy aging initiatives. So it's again, the whole of society approach is very much exemplified here. The fourth area of action is ensuring successful implementation of policies and plans through strategies that include costing and sufficient budget allocation, monitoring and accountability for implementation. And again, a call for a reminder for many of you in the room. You may have seen previously, great ideas have been for far too long around. We're not saying new things here, we're stating the obvious, but unfortunately, stating the obvious is not enough, because it needs to be associated with the appropriate budget and resources, so that the obvious becomes action and becomes an achievement. The next area of action is improving capacity of the workforce through workforce competency frameworks and prioritization of staff development, and supported with adequate resourcing. And again, we need to be aware that just because we have a sufficient number of staff is not enough. We need to have staff that has been allocated appropriate responsibilities to do what the system needs them to do to support mental health for older adults, and including dementia. Next here is improving integration of mental health care into long-term care for older adults. Very often we see those nursing homes with very little, if any, capacity for mental health care for older adults, and dementia is only one of the conditions for that is prevalent in older age. And the last but not least is using the UN Decade of Healthy Aging as an opportunity to raise the profile of mental health among older adults. Again, it's a great advocacy tool that we are proposing here to be used. Next, please. And here, this is my last slide, just to kind of share with you how active and how high the mental health is now in the European agenda. This is the number of events that we are going to work for, either as part of the Pan-European Mental Health Coalition or as separate events. And you will see here, for instance, in September, we will be called by Denmark. With Denmark, we are jointly organizing a meeting for the Baltic and Nordic countries, and you'll see in October there will be the Global Mental Health Summit, jointly organized by the government of Italy and WHO headquarters. And those are just two of the events that you see in this slide. Another point here that I would like to make is that we are aware that there is no near sufficient resources for mental health. So one of the strategies that we are adopting here in WHO Europe is to use sub-regional synergies and sub-regional similarities so that countries can work with each other and can learn from each other. And this is why we are, for instance, working with Western Balkans or with Central Asian republics or with Denmark and Nordic and Baltic countries, so that countries can build upon the synergies that their similarities in socioeconomic, demographic, political organization structuring allow. And with this, again, I am very, very thankful for the European Parliament to have made mental health again a matter of priority, and again to Alzheimer's Europe for being a faithful partner in this road ahead. Thank you. You are muted for the online audience.
That overview, and as I think one point you made was, as far too long mental health or mental ill health has been seen in a narrow silo, so it's a very broad issue, and I think we have some really interesting information there. So those slides will be very valuable to us in the European Parliament as we move forward in this area. So thank you for that.